ask them something about themselves, a personal question, something about their family or their profession or something non-medical, to establish that first relationship with the patient, to make them aware of the fact that you care about them. That's just one example of the many, many things that he taught us about how to take the right care of patients.
Well, that's pretty incredible. What you said about what he was doing, just through the lens of neuroscience, because I mentioned to you offline about my concussion I had. You see in the background of the studio there's a human brain. I call him Mr. Brain or Mrs. Brain. I take him out when I do public speaking, but I know you know the science inside out. But what I was thinking when you said that is it made me think about that's building rapport. It's building trust. Things like oxytocin, right? Things are going in my head. Because I mean, when I walk into my doctor's office when I had my concussion, I was scared, you know what? And I was afraid. And so that's a great thing. He said something, some might say controversial or some might say profound in that video clip. Just comment about his message there. And I think there's such an alignment with what your work is.
Well, he is making the point that obviously, as we said earlier, this is a sacred profession, and there's so much responsibility that's given to caregivers. Another example of something that he said, and it was implied in that conversation, was when you're with a physician, and I'm sure you remember this, Tom, it's not every inflection of the doctor's voice, every manner, everything that they do in the room is important to the patient and conveys a message. And I'll give you an example, Tom. I was with a patient one time, and I was listening to her heart, and as I always did in every visit, and she had a very interesting little sound in her heart. It was like a click. It didn't really mean a whole lot, but it was a little interesting. So I spent a little extra time listening to her in a couple of other positions and with a different part of my stethoscope. She went crazy. She jumped up on the table and she said, "What's the problem? What's the matter?" And I said, "There's nothing the matter." She says, "But you're listening to my heart twice as long as you ever have before.
Wow.
Did you hear something? Is there some problem?" That's the level of perception that patients have when they're dealing with their physicians, and physicians have been very ignorant of the importance of communication, as you said, establishing the rapport and reaching out.